So we decided to collaborate. There was a real meeting of minds. We had a vision for creating a new kind of daycare that was
Mm,
infused with artistic work.
yeah,
And we also felt it should be held in art spaces, didn't we? In ideally in a theatre space during its dark hours during the daytime to create a sense of company rather than daycare. So let's talk about good company as a new model of creative dementia care.
it's as you were saying, Stuart, it's so important that that the willingness and the passion and to work together as arts organisations, yourselves, and Aid Exchange and Green Candle, but as and I think this is the thing we were fearful of, and this was the other thing that was probably on the bio tapestry of the vision, which was we all know nothing works without the other side of the partnership, which is around referrals, which is around health partners. So obviously our relationship with the Alzheimer's Society in Essex has been enormously important to the project as
Yeah.
well. Our relationship with Lucy Gill has been absolutely central to the project and to Ian at Brentwood Theatre because they that I always call it the the comfort blanket around a project that sort of because without that there's nothing really, is there? And also we don't even know what the need is and whether people want to come
Yeah.
or that side of it and
Yeah.
is really important. And I think we've been really blessed in that, and I think the strength of that side of the project has actually enabled it, along with everything that we've done, you've done, as arts partners, has enabled it to grow, for more than a year now.
Well, you touched on the Alzheimer's Society, and that's something important to talk about, isn't it? Because, as you say, we were working on an assumption that there would be a need for something like Good Company, an alternative kind of creative
Yeah.
dementia care. Um, but actually, drawing people into the project was a key aspect of it, wasn't it? And initially, we even thought about trying to engage our own kind of worker to do
Yeah.
that. But
Yeah.
happily, and I think it was down to you, David, that the connection was made with Alzheimer's Society and their kind of regional network down in the Brentwood area, who were delighted to
Mm.
take it on board as an extension to their existing work in supporting vulnerable people in the community. And having something new to refer people into that they thought would really support people in their in helping them to live longer in the community and giving them the confidence, giving them social connections by meeting other people in the context of this kind of creative project. I think it's worth acknowledging that actually the numbers of people involved in Good Company have been quite small,
Mm.
7, 8, 9 couples. So,
Mm.
less than 20 people in each block that we've done,
Mm.
which is not many people, for the amount of money that it's cost to do this project.
Mm.
But, I would certainly argue, and I'm sure you would agree, that actually um, it's the learning, well, it's a number of things, isn't it? It's about the quality of life, of the difference that it's made to those people, has been enormous. And, actually, when you think about it in terms of the costs saved to the NHS for those people,
Mm.
perhaps not needing so much
Yeah.
medication, perhaps not needing to go into care, perhaps not needing to go into hospital so much.
Mm.
I think suddenly it begins to feel a lot less costly than just in terms of the numbers against the budget. But also we were
Mm.
testing a model that I think, you know, we can develop has proved to be something worthwhile, something valuable, and that's something that we'll talk about later in terms of how we want to roll it out.
I'm sure that that there have been cost savings to people going into to NHS treatment and so on, and that I know there's a lot of very positive evaluation of the whole project. I think the other side of it is within Good Company we decided that people were coming to a company to join a company, didn't we? I mean, I remember when we worked at how we had discussions about how we would present to prospective members you know, what language should we use? What was the invitation to people? Because you know, we've been to present before we've started Each Good Company to potential participants, and we've talked a lot about the language, you know, alternative daycare. You're joining a creative company. You're going to be, you know, it's active, not passive, all of those things. But
Yeah.
I also think there's another thing just to kind of add to what you've just said, Stuart, which is around dignity, and which is around valuing people to end of life, and which is about us recognizing the intrinsic value of the arts in supporting person-centered care through to the end of life.